what they call haptics, the science of computer-aided touch sensitivity to refine the process even further by using robots. Surgeons are now using joysticks to manipulate a robot's arms from a console several feet away from the operating table. One company that's leading the way is Intuitive Surgical. This is a US-listed company that has seen, as you can see, its stock jump over 100% just this year as its Da Vinci surgical system gains international appeal. Countries here in Asia are also investing in the technology. Singapore, Hong Kong, Thailand and Japan all have purchased Intuitive Surgical's machines. Now to explain robotic surgery to us is Dr. Susan Lim. She is Chairman and CEO with the Center for Robotic Surgery. Welcome to Squawk Box. It's a pleasure to have you with us today. Tell us what sort of procedures generally surgical robots are used in.
Right. When we talk about robotic surgery, procedures that can benefit from robotic surgery would be procedures which demand better visualization and complex procedures requiring stitching, reconstruction and complex dissections.
And these robots can sort of duplicate these very fine motor skills that a
Yes.
surgeon's hands have.
Yes.
You know, the twisting of the wrist and all that sort of thing.
Much better.
Really?
What it is actually is, if you can imagine a surgeon sitting on a console, pretty much like a pilot in a cockpit flying an aeroplane. So the surgeon is seated in the console and he or she is totally immersed in the console. The console provides a three-dimensional superior visualization. The image of the operating field is 10 times magnified and the surgeon is moving with his or her fingers master controls which then control the robotic instruments which have been pre-positioned in the patient through millimeter incisions. And these robotic instruments have actually 7 degrees of freedom of movement. So they are wristed instruments and they have the ability to seek out very deep recesses of the human body.
That's quite fascinating. I'm going to be pessimistic here and ask you what happens in the case of computer failure.
Here again, it's very important to realize that the surgeon is totally in control. The surgeon is also, in this instance, his or her own assistant. So if the computer fails, the surgeon just continues on with the surgery.
Now,
because the surgeon and the patient are in the same room.
So presumably doctors have to be retrained here to operate
Yes.
these, and there are certification levels for these doctors?
Very strict certification levels.
The other thing that sort of came to mind is that this would be extremely good for work on very small bodies, children for instance,
Yes.
and there are children who go
Yes.
through, say, open heart
Yes.
surgery. Are these robotic
Yes.
surgeons used in open heart surgery as well?
Robotics has seen a phenomenal growth in the areas of urology, cardiac surgery, pediatrics, general surgery, and right now, you know, right across the world, senior surgeons are looking at new applications every day. For instance, we have just done a first series of axillary dissections for breast cancer, and if you can appreciate, that's very fine surgery looking at preserving nerve structures and lymph nodes and such not.
Now, when you talk to, and I don't know if you do, but I assume that you talk to the different hospitals, for
Yes.
instance, just in Singapore,
Yes.
about the benefits, the
Yes.
medical benefits and the surgical techniques of these robotic surgeons, you must also be looking at them from the broader picture of, you know, Singapore wanting to be a center for medical expertise and excellence in the region.
Yes.
So we're going to see a big push towards the acquisition of these expensive machines.
So as chairman and CEO of Center for Robotic Surgery, what we do really is interface with the two main hospitals in Singapore, the Singapore General Hospital and the Mount Elizabeth Hospital, both of which have robots, Da Vinci systems. Singapore General Hospital actually had the system first, and their unit specializes in urology. Ourselves, we are strong in general surgery, and we really work with both hospitals, depending on the budget of the patient.
Well, we apologize for not having pictures. Oh, actually, there we do. We had a little bit there, right there, of the robotic surgery taking place. We have to wrap it up there, but thank you very much for your time with us this morning. Pleasure having you on Squawk Box. Dr. Susan Lim, Chairman and CEO with the Center for Robotic Surgery.